Okay, welcome. My name is Charles Frankel. I'm a counselor with the SHINE program in Pinellas County in Florida. And today I'm going to talk about the Medicare Part D prescription drug coverage. In Florida, SHINE stands for Serving Health Insurance Needs of Elders and is funded through the Department of Elder Affairs. And their mission is for all Floridians to live well and age well. At SHINE, our mission is to provide free, unbiased health insurance counseling through a dedicated network of volunteers empowering Florida seniors to make informed healthcare choices. It's a free program offered by the Florida Department of Elder Affairs in partnership with your local Aging and Disability Resource Center. Specially trained volunteers can assist you with your Medicare, Medicaid, and health insurance questions and provide one-on-one counseling and information. Our services are free, unbiased, and confidential. Excuse me. We are not affiliated with, and we do not endorse any insurance company or product. This is a helpline that you can call to get help with SHINE anywhere in the state of Florida. It is an 800 number, and there are 11 different agencies in Florida. If you're not in Florida, there's going to be a similar program in your state or in Washington, D.C. or other areas such as Puerto Rico or Guam. And it's known nationally as SHIP, State Health Insurance Planning Assistance. And you can Google SHIP to find an area, an agency that can help you in your area. So we do several things. We can help with original Medicare, Medicare Advantage plans, prescription drug coverage, which I'm going to discuss in more detail today, Medicare supplement insurance, also known as Medigap. And there are also some financial assistance programs we can help people with, such as extra help for drugs, Medicare savings programs, which can help pay for Part B premium, or in some cases, even co-pays and co-insurance with Medicare. Medicare does not cover long-term care planning, but we can give you some direction in that area as well. And we also help with Medicare complaints and appeals. And in Florida, at least, we do with fraud and abuse. We can help you in that. But today, let's talk about Part D. What is that? Well, first of all, let's talk about Medicare, where Medicare is a federal government health insurance for individuals over 65 and older. If you're under 65, you may be eligible for Medicare if you have certain disabilities. There are different parts of Medicare. Part A is known as hospital insurance. That's when you're in an inpatient hospital. Part B is medical insurance. That covers several things, such as usually your doctors, durable medical equipment, and some other things. These are known as original Medicare. So back in 1968, when it was first found, this was what Medicare was, just these two parts. Since then, they've added Medicare Advantage plans, which are private insurance companies which offer coverage which should duplicate, well, not necessarily duplicate, but offer the same things as original Medicare A and B, and in some cases, extra things. And then in 2006, Medicare prescription drug plans were also introduced. There's also something called Medicare supplement insurance, or Medigap. And Medigap helps to cover some of the co-payments and co-insurance and deductibles with original Medicare. These are also sold by private insurance companies. Medicare Part D prescription drug coverage was enacted as part of the Medicare Prescription Drug Improvement and Modernization Act of 2003. As I mentioned earlier, it didn't go into effect until 2006. All the plans must be approved by Medicare, although they are sold by private insurance companies. And it can be provided through either a standalone prescription drug plan, or it can be included in a Medicare Advantage plan. In order to be covered in a drug plan, it must be available only by prescription, could be brand name or generic, must be approved by the FDA for medically accepted indications, must be sold legally in the USA, and some drugs that are self-administered, such as many insulin products, it may also cover the cost of the syringes, gauze, and alcohol swabs. There's some drugs it will not cover, such as those prescribed for anorexia, weight loss, erectile dysfunction, fertility, cosmetic, symptomatic relief of coughs and colds, and prescription vitamin and mineral products with an exception. If some of these drugs which are prescribed for these things are prescribed for another medical condition, they may be covered. So who can get Part D and when can you get it? Well, it's available to all people with Medicare, and that means you have either A or B or both. Okay, you don't have to have both in order to be eligible for a drug plan. You have to enroll in a plan to get coverage. And as I mentioned earlier, it could be through a standalone plan with original Medicare, or it could be part of an Advantage plan. So you need to choose a plan that meets your needs because they vary by coverage, costs, convenience, and customer service. There is financial assistance available for some if you meet certain criteria, which is based on income and assets. When can you get coverage? Well, there's an initial enrollment period for Medicare itself, which is 7 months surrounding the month of your 65th birthday. And you can enroll in a Medicare drug plan during that period. It will not be effective until you actually get your Medicare. There's also an open enrollment period every year from October 15th to December 7th, also known sometimes annual enrollment period. And you can add a drug plan or change one during this period. There's some special enrollment periods where you can add a drug plan also. If you qualify for financial assistance, if you lose your credible coverage from some other source, or if you've moved out of a plan's area, you can pick up another plan that serves your area. Also, if you're moving in or out of a residential care facility, you can change plans because sometimes those facilities will use a particular supplier and you will need a plan that they will take. So what are the costs for the prescription drug plan? Well, it varies, but there are monthly premiums if it's an individual standalone plan. Some plans which are part of an Advantage plan do not have a premium, but a few of them do. There is an annual deductible, which varies by plan. The maximum it can be in 2023 is $505. Some plans may have a deductible less than that or a zero deductible. And then there's going to be co-payments or co-insurance, the difference being whether it's a fixed dollar amount or a percentage. And these will also vary by individual plan. Now, all plans must offer a minimum standard benefit level. So there's certain types of drugs they must cover. They don't have to cover a particular drug. And out-of-pocket costs may include monthly premiums, annual deductible, co-payments. And these co-payments are driven by tier, but I'd like to mention that a tier is not something that is set by Medicare. Each plan sets its own tier. So plans may have different tiers. Some may have 4 tiers, some may have 5. And a particular drug could be in different tiers depending upon which plan you choose. There is something called a donut hole. I'll get into that, or a gap. I'll get into that in a moment. And then there's another stage where out-of-pocket costs are even less. And I will also talk about that momentarily. Which is now. So these are the different stages of coverage in a prescription drug plan. And this is common to all plans, whether it's standalone or part of an Advantage plan. So if it does have a deductible, beneficiary usually pays 100%. However, it is not always, you shouldn't necessarily eliminate a plan because it has a high deductible, because in many cases, they do not apply the deductible to some generic lower cost drugs. And that is becoming more common with most plans. The next stage after you have met your deductible is the initial coverage period. On average, the beneficiary pays 25% and the plan pays 75%. That 25%, let me emphasize that, is an average because the actual cost to you could be anywhere from 0, I've seen as high as 60%, where you pay and the plan only pays 40%. After you and the plan have spent a certain amount, so total cost reach $4,660 this year, then you reach what's known as the coverage gap. This used to be a situation originally back in 2006 and for a few years after that, where you were responsible for 100% of the cost. That has now been eliminated or closed, so that now you pay 25% of the drug cost when you're in the coverage gap, whether it's generic or a brand name. And since that's the same on average as you paid before, but it doesn't mean your costs aren't going to change. If you're paying 60% before, now you're paying 25%. You're paying 0 before, now you're paying 25%. So your cost of drugs may go up, it may go down. If it's generic, plan is going to pay the difference. If it is a brand name, the plan will only pay 5%, but the drug manufacturers will pay the bulk of it. And this is important only because it helps determine when you get into the next stage. So that the plan pays some of that cost, that does not count towards what's known as true out-of-pocket cost. So the total of $7,400 to reach what's known as the catastrophic coverage, where your cost will go down, begins only when the manufacturer and you yourself have paid $7,400. So what the plan pays does not count towards getting there. At that point, you will pay the higher of either 5% or $4.15 for generic or $10.35 for brand, unless the retail price is less than that. Plan only pays 15%, and currently Medicare pays 80%. There are going to be some changes next year where Medicare will no longer pay that much, and the manufacturers will start to pay more. Excuse me. These are tips for bridging the gap, but since I say your cost may go up or down, they're really tips for just seeing if you can manage your drug costs in some other ways, whether you're in the gap or not. One, are there cheaper generics that you might take? If there are lower cost drugs that are just as effective, why not take those? By over-the-counter when possible. Okay. Mail order pharmacies may be cheaper, not always, and there isn't always a huge discount when they are normally, although it can reduce your cost. And most plans offer mail order that you can use. When you are choosing a drug plan, there are actually 3 categories of pharmacies. Those who are participating, where if you go to them, you get the stated prices that the plan offers. If you go to out-of-network, then your drug just isn't covered at that pharmacy. So you always have to find at least a network pharmacy for your drug plan. And then there are preferred pharmacies. And preferred pharmacies on some drugs will offer lower cost than the just regular network pharmacy. So it's a good idea to search for those. Use your plan, basically, is what it's saying. There are other discount cards that are available. One of them is a Florida discount drug card. It occasionally will give you a lower price than what your plan does, although not often. It is really more useful for people who do not have drug coverage, and it can give them a better discount. There are other drug discount cards which can at times be very effective and perhaps could give you a lower cost than your copay would be with your plan. There are several of these. Some of them you have to be careful which ones you choose. Some of them may mainly be after your information, but some of them are reputable and can be trusted. There may be a late enrollment penalty if you don't enroll at the right time in the drug plan. If you are eligible for Medicare Part D and do not have any other credible drug coverage for more than 63 days, and you're not covered by a special enrollment period, then you may have to pay a penalty. It's added to your monthly premium. Even if you have a drug plan with no premium in an Advantage plan, you will still have this penalty applied to your plan. If you get extra help, the financial assistance I mentioned, then you're exempt from the penalty. So how do you compare and choose a Medicare drug plan? Because they do differ. They differ by cost, coverage, convenience, which pharmacies are included, which ones have preferred pharmacies. And there is also could be a quality difference between plans. And Medicare does rate them from 1 to 5. Well, anyway, and this is something that's important. Coverage and costs do change from year to year. So if you have a drug plan or even an Advantage plan, they all of them change year to year. And it's really wise to look every open enrollment period, that period from October 15th to December 7th, to see how your plan has changed and compare it to other plans to see if it's still the best one for you. The plan will send you an annual notice of change in October, but that notice itself, it's very difficult to tell what your individual costs are going to do. You have to do some calculations. There's an easier way to find out. So do you have other drug insurance? Does it coordinate with Medicare? Is it credible to Medicare? Are there less expensive alternatives? Some other credible drug coverage is VA benefits and retiree insurance plans. VA benefits is considered credible coverage only if you use it or you register with them. Just because you might be eligible for it is not going to count. You actually have to at least register with it. When we do our search for drug plans, we go to Medicare.gov. It is a great website. It has many other things to offer. If you'll see, there is a section there called Find Health and Drug Plans, and it is the tool that we use. Any SHIP counselor or a SHINE counselor in Florida can help you use it, help teach you how to use it if you want, or actually use the search machine for you. So that is where you go. They do change their homepage quite a bit. So this is how it currently looks, but there will always be somewhere on the front to find health and drug plans. Currently, when you click on that button, you will come to a page that looks like this. And you'll notice there are actually two ways to get to look at plans. The one that is in blue there says save time by using your account. Once you have Medicare, you can set up an account on Medicare.gov. And the advantage to that, especially with drug plans, is that whenever you get drugs on your plan, it is stored there. And if you are not yet taking any drugs, or excuse me, do not have a plan, and you enter the drugs in your plan to see how the plan will work with those medications, it will save them. And so if you want to come back and look at, edit it, whatever, it's always there. If you go to the second method, which is on the right there, continue without logging in, you have to put in your zip code. So because plans are determined actually county by county, the plan type, because this allows you to look at Advantage plans as well as drug plans. And once you do that, and if you enter drugs, it will do the search very well. Unfortunately, if you want to go back later and do it, they will not be there. So you have to re-enter them all. So this is a preferred method, but you need to set up your account to do that and be eligible to. Let me go back for a moment and just say using that plan finder is a very good tool. However, there are some things this year which make it a little less easy to use. And the main thing is that starting this year, for all insulin products, there is a maximum $35 copay. And that's even if you have a deductible, you go through the gap, whatever, $35 is the most you'll pay for any insulin product. Unfortunately, the Inflation Reduction Act that covered this came too late for them to include this in the Medicare plan finders. So it makes it a little more difficult to actually use the system. But that's why we highly recommend that if you are not really familiar with the system yourself, contact a SHINE or SHIP counselor somewhere to help you understand how to best do that. We'll talk about financial assistance now. This is a handout which is available on the floridashine.org website. And it gives some specifics about the two Medicare programs which help people with, they're not really Medicare programs, they work with Medicare, the Medicare Savings Program and the Extra Help Program. So the Medicare Savings Programs are actually Medicaid programs, and they may help pay out-of-pocket costs for Medicare and Part B, medical insurance for those who qualify at the lowest level. They will pay Part B premium for anyone who qualifies for that program. The Extra Help Low Income Subsidy Program, LIS, is both of these are national, but the first one is administered by Medicaid, so it's really varies from state to state. Several Medicare savings programs. The Extra Help is administered by Social Security, and it provides assistance with the cost of prescription drugs and works in conjunction with the Part D. There's also a medically needy program, which can provide help to people on Medicare. This is also a Medicaid program. And then there are other Medicaid programs. In all cases, eligibility is based on gross income and asset limits. It will vary by program, especially the Medicaid programs. They vary state to state. So I mentioned the LIS is more of a national program. It's determined by Social Security in the case of LIS. In Florida, it's determined by the Department of Children and Families for the MSP programs. You can apply online for either program, or you can get someone with SHINE or SHIP who will help you apply, either online or with paper form, if that's more convenient. So mention the MSP has limited Medicaid benefits, Part A and B premiums, in some cases, deductibles and co-insurance. And applications are processed in Florida by the Department of Children and Families. The low-income subsidy, people with slightly higher income may also qualify for this. If you qualify for one of the MSP programs, you are automatically qualified for the LIS program. However, if you don't qualify for one of those, you may still qualify for LIS on your own. With the lowest income, you pay no premiums and deductibles, and you have small or no co-payments. Those with slightly higher incomes and assets may pay a reduced or no premium, have a lower deductible, and pay a little more out of pocket. Starting next year, there will be no distinction between these two. Everyone will get the full benefits. And applications are processed by Social Security, and you can go to their website to apply or work with a SHINE or SHIP counselor. As I mentioned, some Medicare beneficiaries may automatically qualify for Extra Help if they're receiving Medicaid in actually almost any form, whether it's SMP, MSP, or medically needy or full Medicaid. If you are receiving supplemental security income, you are qualified for full Medicaid and then also get the extra help. If you do not get it automatically, anyone else can apply at any time. If you are not sure if you qualify, go ahead and apply. The worst that can happen is they turn you down. It does not reflect on your future eligibility. And sometimes there are certain things which may or may not count that you're not always aware of. The guidelines change a couple times a year. So I'll give you one thing. If you are earning income, you have a part-time job, they don't fully count that. So that's something that's not always considered when people are trying to determine if they're eligible. There are other ways to save. There are patient assistance programs. Some manufacturers and distributors will offer these. Some retailers offer, for some medications, very reduced prices. Free samples from your doctor, not as common as it used to be. And mail order bulk purchases may or may not give you some help. I'm going to briefly talk about Medicare fraud and abuse. Okay. Fraud is purposely billing for services that were never given, or to bill for a service that has a higher reimbursement than the service produced. Where abuse is the same thing, only it's not intentional. So intent is the difference. If you do find a problem that this has happened to you, it's not going to be up to you to determine if it's intent or not. There will be someone else who will investigate that to determine. What we are most concerned with is prevention. So make sure that you protect your Medicare number is number one. Scam artists use Medicare numbers to bill for services and equipment that you did not receive or did not need. And you're going to get stuck with a copayment, as well as Medicare getting stuck for the full bill. So to detect, check your Medicare summary notice if you have original Medicare, and review the claims, check for possible mistakes. If you find one or think you find one, sometimes it's difficult to know. One, call the provider, see what they have to say. If you're not satisfied, then escalate it. Because Medicare loses an estimated $60 billion each year due to fraud and errors. Medicare is huge. They pay millions of claims every day. And so if they were to just investigate everything before they paid it out, it just would not work. So unfortunately, Medicare has to frequently pay before they know whether or not it's a fraud. And that makes it a good target for these scammers. The new Medicare card is one step they've taken to reduce it. It replaces an old card, which all of them had a Social Security number on it. So if someone gets a hold of your card, be sure to report it. You can go to medicare.gov to do that. So here are some tips. Treat your Medicare card like you would a credit card. Only share cards and numbers with trusted sources who need that information to serve you, such as a doctor or pharmacy. Do not rely on advice or offers from unknown persons who will call, visit, or approach you in public, and never sign a blank medical insurance form. Medicare will never call you unless they have informed you in some other way ahead of time that they're going to do so. So if someone calls you from Medicare and you are not aware that they were going to do so, it's probably a scam. So there are two notices that you will get, a Medicare summary notice and explanation of benefits, and review these to see if there's anything suspicious. See something unusual, check with your plan, call Shine. You get someone requesting your Medicare number over the phone, do not give it out. Contact someone, your local law enforcement, Shine, or someone else of authority if you think you have been a victim of fraud. This is just an example of a Medicare notice. Make sure there are certain things as your provider, the one you went to, Is the date correct? Is the location correct? Are any services that appear twice? Okay. Are there questions or comments?
Charles, I have a question. Is there a local phone number for the SHINE program in the Pinellas County area?
Oh, good question. Yes, there is. If you call the 800 number, it will direct you to the area agency that is affiliated with the area code you're calling from on your phone. So if that's not in Pinellas or Pasco County, you will not get our agency. The local number is 727-217-8111.
Thank you.
You're welcome. Anything else? Well, thank you all for sharing your time with me today. I hope you got something useful out of this.